Dudley High School graduate from UNCG also, and my father is an A&T graduate. And I also got my master's in public health from UNCG. And I've been studying, that was in 2002, and I've been studying what is the basis for our community health and what makes our community health better. And so in my studying and working with several people, I wanted to share some of the things I found that are similar to what some of the other forum members have said. But I learned that a fifth of the people in our state have incomes that are below 138% of the federal poverty level. And that's approximately $17,000 a year for one individual in a household. And that is what is around the amount that qualifies somebody to get Medicaid if they make a certain percentage of the federal poverty level. But right now, North Carolina is the 10th highest state in the nation for having people without health insurance. And when you don't have health insurance, you're less likely to get the life-saving procedures and medicines that you need. For instance, this week, I took my daughters to the dentist for an x-ray and for a regular screening. And if I didn't have health care insurance, for the two of them, it would be $340 to cover the cost for the both of them. And it hurts my heart to think about the families who have to make the choice, because that's about 2 trips to the grocery store. And so if people have to consider which are they going to do if their child has a hurting tooth, or are they going to get the groceries that they need or the child care coverage, they have to make that hard choice, and that really hurts me for the people that we know in our community. So if Medicaid was expanded in North Carolina, more families could have the health insurance for those basic needs. And these are our federal and state tax dollars that would run this program. And I want my tax dollars to run this for my neighbors. I also care about the experience of other black women like myself. North Carolina continues to contribute to the diverse workforce because of the efforts and the talents that we have placed here for generations and generations. And I care that black women get quality health care when they're diagnosed with breast cancer, lung cancer, or even with HIV. Did you know that the second leading cause of death in the country for black women is breast cancer? And that's second to lung cancer being the highest cause of death for black women. And this is nationally from 2015. Although there are more white women who are diagnosed with breast cancer, there are more black women who die from breast cancer. And breast cancer is not an easy road for anybody because of the treatments and because of all the hardships that women have to go through. But to lose the woman of your family to breast cancer like we did in my family, my mother passed to breast cancer, is even more devastating without that life force. And it's also because of there's more black women who are dying from breast cancer due to the lack of access to health care, but also it's the quality of health care. It's because of generations of disadvantages through structural racism that has provided a lack of opportunity for the women in our community, and I need that to be addressed. Also, did you know that the rate of black females living with HIV, with an HIV diagnosis, is 14.3 times that of white females in North Carolina in 2015? That's 14.3 times higher. So if women are not able to get the care that they need, they're gone. And we are taking care of families and contributing to the workforce in North Carolina for generations and generations. So who's still uninsured in North Carolina? We've been hearing some of the statistics already. Among white people in North Carolina, the uninsurance rate is 9%. Among black people in North Carolina, the uninsurance rate is between 11 to 13%. And among the Latinx people in North Carolina, the uninsurance rate is around 30%. So that disparity there shows you that although the people who are struggling with the most morbidity and mortality rates, we don't have the health insurance to get us the quality access care that we need, and that needs to change. Although nationally, there are more white women, white Americans, who use Medicaid. That's 43% of Medicaid is used by white Americans, compared to Hispanic Americans use it at 30% and black Americans use it at 18%. Again, all these levels of differences show where there's structural difference by race in our country. And we need to understand, why is that happening? Why is North Carolina not making a better choice for our citizens here? So I am in support of us getting to the expansion of health care, the expansion of Medicaid. Since the Affordable Care Act was passed in 2010, there are more people who have health insurance nationally, but this gap is what we need to work on. And so for non-Medicaid expansion states like ours in North Carolina, there are approximately 2 million poor adults who remain ineligible for Medicaid. And so these are the reasons that we need to choose to expand Medicaid so that we can have the coverage we need to keep the people here longer. Thank you.